After providing assistance to Hmong refugees for 4 years, MSF has left Huai Khao camp in northern Thailand. Stationed in the camp, the Thai army is putting increasing pressure on the Hmong, including denying them access to healthcare.
At the end of last year, the army decided that patients will not be allowed to get direct access to MSF clinic at night and forced them to pass through a military checkpoint. Mid-February 2009, the army intends to post a soldier around the clock at MSF gate of OPD clinic to control the movement of patients. Beginning of March, the army stopped MSF from distributing food to the population. Finally, in April 16, the army took the liberty of locking MSF clinic and warehouse without any warning. Since the closure of MSF clinic and store gate, part of the population has refused to come for medical consultation because they fear to be arrested.
Originally from Laos, the Hmong fought with the French and then the US Army until the end of the Vietnam War. Today, they have no guarantee that they will be safe in Laos.
People's testimonies are consistent with reports given by human rights organizations and independent journalists who have visited the area of Laos from where many of the people come. We can also guarantee that there are people in the camp who bear physical scars, such as bullets and shrapnel wounds, from alleged abuse in Laos.
The Thai government nonetheless reaffirmed in March its intention to repatriate all Hmong refugees before the end of 2009. Since December 2008, 200 people have been sent back monthly, 500 in March. According to Thai authorities, the returns are voluntary. In reality, they come after arrests and imprisonment.
I mean, we have been raising this issue for many years, not only publicly, but also by diplomatic channel. Many occasions we've been talking about the situation, expressing our concern about the population, trying to put pressure to ensure some changes. But nothing changed.
In such conditions, MSF is no longer able to pursue its activities independently. It has called publicly for an independent organisation to assess the rights of the Hmong, whom the Thai authorities regard as illegal migrants rather than as refugees. Nearly 5,000 Hmong refugees remain in the camp. UNICEF, working through the Thai NGO Khao, is prepared to take over the MSF project. 6 months after Operation Cast Lead, the consequences of the war are still visible in the Gaza Strip. Destroyed buildings continue to bear witness to the violence of the Israeli offensive, which worsened the already fragile social and economic situation.
Since the war, the situation in Gaza has been pretty difficult because of the continuing blockade. The Israeli occupation forces also prevent construction materials from entering. It's difficult for people whose houses were destroyed, who can't rebuild their homes, and who are still living in camps.
80% of the population now relies on humanitarian aid. After the ceasefire, health facilities received extensive donations, making medication accessible. But given the blockade, shortages are likely to arise.
Right now, the population in Gaza does have reasonable access to healthcare. Medicines are available and there are no strikes like the one last year during the month of August. So the situation is pretty much acceptable. But we're very concerned about the weeks and months ahead, when health centres will again face drug shortages and people will no longer have access to medication.
This patient was wounded by gunfire about 10 days ago. He has come to the MSF hospital for treatment. The medical team examines him. His wound is oozing and is painful.
He told me I need to be consulted. I cannot wait. My wound is open and it's oozing blood and discharge. So I think it's urgent. So I bring it, I discuss the case with our team and bring it here for consultation.
This nurse is in charge of determining which patients, in hospitals or at home, need post-operative care and whose condition may deteriorate rapidly. Identifying and treating quickly the wounded who have not been able to receive important follow-up care remains a priority.
So we'll change his dressing and we'll continue to do so once he's gone home. If he's able to go to the clinic, we'll go and pick him up. If not, we'll go to his house.
Over the past 4 months, teams have been working in 2 operating rooms in inflatable tents set up in the centre of Gaza. Surgeons have performed more than 244 specialised operations, including skin grafts and the removal of external fixators. To meet the increased need for post-operative care, a third MSF clinic has opened in the northern Gaza Strip. 658 patients, victims of explosions or gunfire, mainly during the last Israeli military operation, have received essential care, including the dressing of their wounds and physiotherapy. 4 additional mobile teams have been set up. A total of 7 teams crisscross the Gaza Strip every day. The team of psychologists has also been reinforced. This is the Chad Zulu district of Malawi. Valerie is a midwife and supervises the project focused on the prevention of HIV transmission from mother to child. Infants are infected primarily during pregnancy, childbirth, and breastfeeding. Pregnant women are informed of the need to do a screening test. Those infected with HIV receive antiretroviral drugs that reduce the viral load and thus the risk of transmission.
The
transmission rate is about 25% during childbirth. If the mother takes triple therapy, 3 antiretroviral drugs, before and during childbirth, it helps considerably to reduce the risk of transmission. And then the mother will breastfeed, and she'll have her ARV medication to continue at home. Babies that come within 72 hours will be given syrups.
Prophylactic treatment is effective only if administered within 72 hours of birth. Without it, 30 to 45% of newborns will be infected by HIV, and half of those will die before the age of 2. That's why it is important to know the infant's HIV status as early as possible, so that treatment can begin. DNA tests can reveal that status as early as 6 weeks old. However, these tests rely on technology that is scarce and that calls for trained staff, both of which delay early treatment of newborns. Otherwise, the first test can be performed only at 9 months, repeated at 12, and confirmed at 18 months.
To be sure of the test results, mothers need to stop breastfeeding, although we can't be sure of that. The transmission rate during breastfeeding is 10 to 12%. Even though we recommend that mothers only breastfeed their babies until the age of 6 months, and we perform the test at 9 months, we're not sure that the mothers have stopped breastfeeding. So we repeat the test at 12 months and again at 18 months.
Access to triple therapy for all pregnant women remains the best means of preventing mother-to-child transmission of HIV. In developed countries, all women have access to antiretroviral treatment throughout pregnancy, and their babies are fed on formula milk. Such possibilities are virtually non-existent in developing countries, despite the fact that that is where 90% of HIV-positive babies are born, mainly in sub-Saharan Africa. MSF treats more than 1,400 mothers in this programme. Doctors working in an MSF field programme or participating in an MSF training course can now benefit professionally from time spent on a humanitarian project. MSF has just received approval from the French National Council of Ongoing Medical Training and has obtained the status of a training organisation. This development should attract more young doctors, who we have difficulty recruiting today.
It's less attractive for doctors to go into the field. It requires an enormous amount of time and energy, and it interrupts a career path in their home country. It's clearly important for them to be able to obtain an added benefit from working in the field and from the training programs that MSF offers, both in and out of the field.
The time a doctor spends in a field programme or in training with MSF will now count towards satisfying continuing education requirements which doctors need to fulfil throughout their career. This approval does not just affect French doctors. It is valid for physicians from all countries that have signed an agreement with France on this issue, which includes the 27 members of the European Union, the US, Canada and Australia.